So think about the last time you took a big exam. You probably got pretty nervous about it, right? Anxious maybe right before the exam? Well, this is completely normal and might even be useful in some situations because it can make you more alert and more careful. After the test, though, you might kick back and breathe a sigh of relief, and then the stress goes away, right? For some people, about 3% of the population, that stress doesn't go away, and at this point the stress is considered to be anxiety. This anxiety also might get worse over time and cause things like chest pain or nightmares, and might even cause you to not want to leave the home, and at this point where it starts to interfere with your daily life, like work, school, and relationships, we might even call it an anxiety disorder. Now, one particular type of anxiety disorder is generalized anxiety disorder, or GAD. This type is characterized by anxiety about everyday things like money, health, family, work, and relationships. Sometimes even the thought of getting through the day produces anxiety. And it's this anxiety, as opposed to like normal anxiety that everybody feels, has three main pieces. The first is that it's persistent, meaning that it doesn't seem to go away. The second is that it's excessive, so it's usually way more than someone else might have given that situation. And third, it's typically pretty unreasonable, as in there really isn't any reason to worry about whatever you're worrying about. Now, people with GAD might even be aware that these worries are excessive and unreasonable, but they don't know how to stop feeling like this or feel like it's completely beyond their control. Some people with mild GAD might be able to function socially and hold down a job, but others with severe GAD might have trouble with the simplest of daily activities. So what causes one person to have GAD and one person to not have GAD? Ultimately, as is the case with many psychological disorders, we don't know. Genes, though, are thought to play a role, since sometimes it runs in families, and also the environment you're in, especially if high levels of stress are involved. Also, several parts of the brain have been linked to fear and anxiety, and continued research into these areas may provide some clues in the future about GAD. Alright, so how might we know that someone has GAD? What are the signs and symptoms? Well, the main symptom is frequent worry and tension or stress for little to no reason. Other symptoms might include things like edginess or restlessness, or an impaired concentration or feeling like your mind just goes blank. And then also irritability. And these psychological symptoms can even be severe enough to lead to physical symptoms, like difficulty sleeping. And this is one of the biggest physical complaints of people with generalized anxiety disorder. Our bodies need to recharge when we sleep, right? With that said, insomnia can take this serious toll on your physical health, which means your body isn't functioning at its optimal levels, is it? Besides insomnia, though, another physical symptom might be digestive problems. Chronic stress may lead to eating more or less than normal, and many people even experience diarrhea or constipation as a result. And finally, muscle aches and soreness is also a pretty common symptom of GAD. This happens from increased muscle tension, because people with anxiety carry around this tension in their bodies, which can lead to tense shoulders, back, jaws, and muscles, and this can even manifest as clenched jaws or teeth grinding. Overall, these physical and mental symptoms usually come about gradually, typically starting in the teen years or young adulthood, but over time they have this serious impact on your well-being. Additionally, there might be periods where symptoms seem to be worse, or they might get worse during periods of high stress. Unfortunately, there aren't any tests that'll tell you whether you have GAD or not, and a proper diagnosis will be based on a medical professional's questions about your symptoms. So from the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, the following criteria are given for a diagnosis of GAD. Excessive anxiety and worry is present and occurs more often than not for at least 6 months and is clearly excessive. And then the other one is anxiety and worry is associated with at least 3 of the symptoms that we went through, and in children only 1 symptom is needed for a diagnosis. And once it's been diagnosed, we're going to look to treatments, right? And GAD will often be treated with psychotherapy, medication, or both. Specifically, within psychotherapy, we'll often try something called cognitive behavior therapy, which is really useful for treating GAD since it tries to teach you different ways of thinking, behaving, and reacting to situations that reduce your feelings of anxiety and worry. And the other form of treatment is medication, and there are two types that are usually focused on, and the first are anti-anxiety medications. These tend to slow down our central nervous system, so our brain, and so they have this kind of relaxing and calming effect. Typically, anti-anxiety medications are benzodiazepines. Apart from those, though, antidepressants can also be prescribed. And these are approved for depression, but have also been found to be effective for treatment of anxiety as well. The most commonly prescribed antidepressants are selective serotonin reuptake inhibitors, or more commonly just called SSRIs. These guys work to regulate serotonin levels in our brain and elevate your mood. Knowing that these treatments exist, some people respond better to cognitive behavior therapy alone, and some respond better to medications alone, while still others respond best when both are used together. It totally depends on the patient, and so it needs to be tailored on a case-by-case basis.